If you rely on Medicare for chronic wound care, the rules are about to change dramatically. The government is proposing a staggering 90% cut to funding for advanced wound treatments. This isn't a small adjustment. It's a policy earthquake set to affect millions of seniors. The outcome? Your local wound care clinic could be forced to shut its doors for good. We'll show you what's changing, why it's happening, and the one thing you must do now to protect your health. So, before looking ahead, how does Medicare Part B cover wound care today? It pays for outpatient services, doctor visits, supplies, and certain therapies. To receive coverage, your treatment must be deemed medically necessary, which requires a specific doctor's order. This includes vital treatments like debridement, negative pressure therapy, and advanced dressings, tools doctors use to prevent infection and speed healing. Significantly, it covers advanced skin substitutes, a standard of care for diabetic foot ulcers. This treatment is at the center of the storm. Typically, after your deductible is met, Medicare Part B pays 80% of the approved cost. You are responsible for the remaining 20%. This is the system we have now, one that provides access to life-saving care. So why is the government planning to dismantle it? The answer from CMS, the agency running Medicare, is money. Spending on skin substitutes has exploded, from $256 million in 2019 to over $10 billion in 2024. CMS claims this is from abusive pricing. Their proposed solution is a blunt instrument, reimbursement for these products. The goal is to stop overspending. But in a few moments, you'll see what happens when you take a sledgehammer to a system millions of seniors depend on. It isn't just about money. Starting in 2026, there's a new clinical hurdle. Your wound may need to heal by 50% with standard care before you even qualify. So it's a double hit. Lower payments for clinics and stricter rules for patients. This combination is what ignites the crisis. Policy details can feel distant. Let's make this real. What does this actually mean for a patient trying to get care in 2026? First, your doctor may stop offering skin grafts. The new reimbursement won't even cover the product's cost. Second, entire wound centers, especially in rural areas, may be forced to close. Their business model becomes unsustainable. Third, you'll face delays. You will have to fail first for a month under the new 50% rule before getting advanced care. Fewer doctors, fewer clinics, and more hurdles to treatment. This is the new reality patients will face. And the effects of these treatment denials are not minor. Medical professionals are sounding the alarm about a grim forecast. This is the result of the sledgehammer policy. More severe infections, hospitalizations, and preventable amputations. A non-healing wound can become systemic. We don't have to guess what happens when care is delayed. During the pandemic lockdowns, we saw more infections, hospitalizations, and amputations. And here is the tragic irony. This money-saving policy will likely lead to higher long-term healthcare costs. An amputation costs far more than the treatment to prevent it. So, a policy meant to stop billions in spending could cost more in hospital bills and human lives. Let's connect these dots back to you. Recall those millions of people from the beginning? Each one is now at a higher risk because the standard of care is being placed out of reach. Recall CMS's goal to cut billions spent on skin substitutes. That goal is now directly at odds with the fact these cuts will likely increase spending on amputations. The argument is clear. This policy tries to solve a financial problem but creates a more dangerous healthcare crisis. It values short-term savings over patient outcomes. The system is set to become much harder. The clock is ticking until January 1st, 2026. This brings us to the main question. What can you do about it? This is why you must seek treatment now. Do not wait. The window of access to the current standard of care is closing. By seeking treatment today, you get care under the current, more accessible rules. You can establish a plan before a specialist's ability to provide care is restricted. If you have a non-healing wound, a diabetic ulcer, a pressure sore, make an appointment. Ask your primary care doctor for a referral to a wound care specialist today. Waiting until 2026 could mean your wound gets worse while you're forced to jump through new hoops. If care is even available, your health and your limbs are on the line. This change is coming, but you have the power to act now. Take control of your health. Don't let a policy change decide your future.